This is the Berman Method Podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we're rolling, baby, rolling. Dr. Jake Berman here with my two beautiful co-hosts,
Jenni Berman, physician assistant.
And Vera K, little baby Vera K.
And Vera K, who is hopefully going to nap soon. And not scream.
The Berman Method, where we are focused on treating problems and not symptoms. We're David going against Goliath, Goliath being the corporate medical system who does not have your best interests in mind. They are focused on client retention, or pharmaceutical. Big Pharma is focused on client retention. If you don't know what I'm talking about, name me one pharmaceutical that doesn't have a side effect.
Radio silence.
There isn't one. So
Right.
yeah, take this drug to treat this symptom, and then you have to take another drug to treat the symptom from that drug. And it just goes on and on and on. So they're not focused on curation. They're focused on client retention. And I think that I want to do a rant.
I was just about to warn everyone. I hope you're ready for a rant on this podcast, but it's going to be a good one. So just stick through the rant and then you'll learn some really important things after.
It's been a while since I've ranted, hasn't it?
Like a week. Last Monday.
So we're in March Madness. So we've been watching a lot of TV lately. We don't ever watch TV. It's usually Netflix or some recorded show on YouTube TV that we fast forward through the commercials or so.
And by we, he means
Me.
yeah.
By me. We, I mean me.
Mm-hmm.
So I don't watch TV. However, for March Madness, I've been watching a lot of it. I've been watching a lot of these games, been some really good games, and I've been able to see some really interesting drugs on TV, on the commercials. So the pharmaceutical company is trying to push these drugs. And I was in tears this weekend because the commercial for the drug Paxlovid, did I say it right?
Yes, Paxlovid.
Paxlovid apparently is this drug that you're supposed to take when you get COVID.
Correct. It's an investigated drug. It's not FDA approved for COVID treatment yet, but it is a very common treatment for COVID-19.
And I didn't even see the entire commercial until the very end, because I think I was feeding Vera or something at the time. And then right at the very end, they started rambling off these side effects, and it caught my ear. And I said, Jenni, what the hell drug was that? She said it, so I hit rewind and I went and watched it. So Paxlovid is a medication, a pharmaceutical medication that you're supposed to take to ease your symptoms for COVID.
Correct.
Here's the side effects for Paxlovid.
Well, before you start, we had been watching March Madness prior days, and my sister was in town, and I said to her, it's interesting when 6 minutes out of this 8-minute commercial is talking about the side effects and who should not take the drug. So it was just, and then you picked up on it the
same
next
drug?
time. Yeah, the same drug. I had said that to Nikki 2 or 3 days before you picked up on it, that it's just, it blows my mind that 6 minutes as 8-minute commercial is side effects and who should not use the drug.
I could not believe it. So guys, this is why we're doing this podcast. This is absolute bullshit. So here's the side effects for Paxlovid that you're supposed to take for when you get COVID to help ease the symptoms of COVID. Altered or impaired sense of taste. What? I thought that was
It's
one of the
already
ways.
a symptom of COVID.
I thought that's how you knew you had COVID,
Right.
was your sense or smell or taste went away. So altered or impaired sense of taste, diarrhea, increased blood pressure, muscle aches, abdominal pain, nausea, feeling generally unwell. When I read that one, when I heard that one, I'm going, are you effing kidding me? What are the effects of COVID?
Right. Right.
Feeling generally unwell, loss of taste or smell,
Diarrhea,
diarrhea.
abdominal pain, fever.
So
Yeah.
here, take this medication, this pharmaceutical drug that they're spending billions on, because you can't get that much time on commercial air unless you're spending millions and millions and millions of dollars on marketing. Take this medication that's going to ease your symptoms. Yet the side effects of this medication is probably going to be worse than COVID itself.
Right. And it's not, like I said, not FDA approved. It's an investigative medication that the FDA has deemed okay to utilize because it's supposedly reducing the cardiac side effects of having COVID-19. But again, who is using this medication is the people who are actually well enough to take the medication. So naturally, they would have a lower risk of cardiac event anyway. But again, I'm always the middleman of some people need the medicine, it helps some people, but I definitely agree that the amount of side effects was outrageous.
It was asinine, not outrageous. I mean, it's completely off the wall. The side effects were worse than the actual sickness itself.
It's true. It's true. And who's to know, for a majority of the people that are taking this medicine, if you didn't take the medicine, would your symptoms have resolved in an equal amount of time versus when you took the medicine?
Yeah, that's another thing that could take us down a completely different rabbit hole is how many true randomized control trials are there where it's double-blind studies, and you have to question all of these things. But at the end of the day, when this particular business, this particular company saw the opportunity to market this bullshit drug to millions and millions of viewers because millions of people are tuning in for March Madness, they seized the opportunity.
Yes, I agree. I agree with that. And so that just kind of leads us into what we do, right? So we, like you already said, we're David against Goliath. We're going against the corporate medical system because there is so much more to boosting your immune system, improving your immune system, making your immune system the healthiest version that it could be, so that when you do get this virus, because at some point, probably majority of us are going to have it or have had it, when we do get the virus, how can we make sure that our insides and our immune system is the most optimal that it can be to be able to fight viruses like this?
One of the things that has completely changed in my own immune system that is objective, this is not subjective at all, is how frequently I get colds. Because when we first started dating, it was like every 2 to 3 months I had a cold.
Right.
And you used to make fun of me. It's like, wow, you are sick all the time with my man colds. Because of course, when I had a man cold, the whole world was ending.
And you were addicted to hand sanitizer.
Yeah, I remember that too.
Addicted
Yeah.
to hand sanitizer.
Yeah, I was using it all the time. And fast forward through, this was going on before the whole COVID thing started. We started taking Juice Plus, or you started getting me on Juice Plus. Juice Plus are gummies for essentially supplementing fruits and vegetables.
Antioxidants,
mm-hmm. Right? So it's Juice Plus. You can look it up. Gummy vitamins is what they are.
Or capsules, but we take the
capsules.
Gummies, yeah.
So I started taking those, and this also started happening around the same time, or around about the same time I did my blood test to see what my sensitivities were. So cut out a couple of things out of the diet there.
And we checked your vitamin levels. So I'll kind of recap when all this started is, like you said, when we first got together and started dating and then got married, you were sick consistently, I would say. Every 2 to 3 months, I think, is consistent. And then I went into pediatrics, and then you were really getting sick all the time. I was coming home not sick, being in pediatrics, but then he would get sick because I would bring home probably the germs, but I had a stronger immune system at that time, so it wasn't affecting me. So that's when we started to be like, okay, we have to change something. We got on the Juice Plus, both started taking it. We did lab work and found that you had some vitamin deficiencies. Your vitamin D was low, your vitamin B12 was low. And then we also did the food sensitivity testing on both of us to start looking into our gut more, just knowing my history of gut health as well. So that's where we started, and we said, okay, we need to start eliminating these foods. We need to start supplementing with these particular vitamins while we're healing your gut. Then hopefully we won't have to stay on those vitamins as your gut heals and you're absorbing your nutrients more efficiently.
Right. And through the whole COVID thing too, we just boosted everything. So we're taking double doses of Juice Plus and vitamin C and zinc and things like that. And I can honestly say that over the past couple of years, it's now more uncommon for me to get sick than common.
Right.
And I'd even go...
And even with having a 3-year-old now.
And I would even go out on a limb and say that you get sick more often than I get sick now.
That is true.
Which is a complete 180. Some of it's self-induced. You're sharing your straws with Stella a lot.
I don't know that I would say I'm purposely sharing my straws, but when my daughter comes up to me with her cold and says, I drink your water, Mama, I'm like, great.
Versus me, I'm very anti-Stella. Don't you drink that water. You go drink your own water. Versus Mama, yeah, go ahead.
I just said it wasn't that. Like,
Sure.
She did it to me 2 weeks ago.
Yeah.
She was like, I drink out of your water, Mama. She also is always in my face and on top of me, and I'm a mom. So, however, I will say I do get sick more often than I used to, definitely, with having a toddler. However, we and I particularly do not get sick every time she gets sick. And that's huge in my opinion, where there's a lot of moms who will get sick every single time their kids catch something. They will catch it or have a GI sickness, illness, and a lot of times the parents will get it directly after the parents have it. And we can honestly say that Stella may be sick 3 times to our 1 time that we actually catch something that she has. So again, just the supplemental support, making sure our immune system through more natural approaches and making sure that our gut is as healthy as it can be. 75% of the immune system starts in the gut. So that's where we have to take a step back and say, okay, if I'm getting sick often, or if I have an autoimmune disease, I have migraines, I have headaches, I'm not sleeping through the night, my body feels run down, I have vitamin deficiencies, we have to take a step back and look at the gut lining itself.
Yes. Just this past weekend, Stella was sick. And then 2 or 3 days later, you got sick. And I was like, oh, hell no. I started taking excessive zinc. These are not prescriptions, by the way. I'm not trying to say this is what you guys should do. I'm just saying this is what I did that particular day. Was I was taking extra zinc supplements, and I was taking emergency, and knock on wood, I never got sick.
Right.
Versus 5 years ago, there is no doubt in my mind I would have been sick.
100%.
Definitely would have been sick.
And, I have to do a little asterisk here is these vitamins, specifically zinc is a metal. So we definitely cannot take excessive doses of zinc long term. And zinc is not even something, we don't take it every day. Even during COVID, we didn't take it every day because it's a level that needs to be monitored via blood. It needs to be checked and make sure that we're not taking too much of it. So it is something that we will utilize. Zinc, echinacea, Juice Plus are things that we will increase and utilize when we are sick or encountering illness. Someone else in the family is ill, but it is not something that we will take on a consistent basis and really shouldn't be unless your vitamin levels are being monitored. However, I will say that I think those were and are effective for you because your gut is a lot healthier and your other vitamin levels, your B12, your D, are much better than they ever were 5 years ago either.
Yeah, definitely. I mean, that's 100% what I'm attributing to it, is because that's really the objective change that I've made. It's not like you just magically build your immune system without doing something about it.
Because you also used to live on Airborne. Do you remember how often in Alka-Seltzer?
Oh, speaking of that, here's another objective thing. Is every single time I would fly somewhere, I would get sick.
Every time.
So that's
Jake started wearing masks on airplanes.
No,
or not
I didn't.
Masks. The face coverings. Yes, you did. Before COVID ever even happened, you would wear a face covering on an airplane because you were like, I always get sick on the plane.
It was those buff things.
Yeah, a buffer.
Yeah, not a face covering, mask, whatever, the fishing things. Because I was convinced
covering your face. That's a face covering.
Stop. I was convinced that if I could just do anything to help me not get sick on a plane, I was taking Airborne before and after. If I had a layover, I'd take more Airborne. It was like I was ODing on Airborne. However, again, knock on wood, I don't do any of that stuff anymore. And we fly more than I've ever flown ever. Mm-hmm. In the history of my life, we fly more nowadays than I've ever flown. And I don't get sick anymore.
So what do you think is your objective change that you've made then versus now?
Oh my gosh. If you would have asked me that question and given me an hour, I could have written down a lot of things. One of the biggest things is my overall diet, where BJ, before Jenni, there were a lot of things that I consumed that were full of preservatives and just not healthy because, bachelor life. So a lot of the meals that I made came from a box. I would go out to restaurants that every single restaurant that I went to, food came off of a Cisco truck. So full of preservatives. I think we talked about that in the last episode or a couple of episodes ago, is be cognizant of which restaurants you go to. So those are two big things.
That's exactly what I would have said. Majority of the things, I would say 80% of the things that you ate came from a box. Yeah. Other than your venison that you harvested yourself and maybe some chicken that you bought from the grocery store, but everything else came from a box.
Yeah.
All your sides came from a box. All the bulk of the meals came from a box. So yeah, a lot of preservatives, a lot of gluten, a lot of dairy.
Yeah.
A lot of egg, which we know your body has a sensitivity to.
So just a lot. Now it's not.
Right. So the point of all of that we're talking about that and him specifically with how often he used to get sick and how vulnerable he was to viruses before and the types of foods he was putting in his system before, the vitamin deficiencies as before, is to say that we have control over our immune system. And even if, you're hearing this and you say, but I have an autoimmune disease and I have to take this drug and that reduces my immune system, so I'm more vulnerable. That may be true. Certain drugs do reduce our immune system and make us more vulnerable. However, we still have the ability to strengthen our gut lining, reduce the inflammatory process occurring in our system to support the immune system. Even if we are on immunosuppressants, we can target the gut health internally and reduce the inflammatory response that we're having to, one, hopefully reduce the amount of immunosuppressant medications that we need, but two, with reducing the internal inflammation, even though we are on those immunosuppressants, we're still supporting the immune system the best we can. So because you're taking the medications or because you have an autoimmune disease is not an excuse to say, well, my immune system is ruined. Like I'm just vulnerable. It is what it is. No, let's take action and start making some adjustments internally and actually optimizing other vitamin levels, because I can guarantee you that on top of your gut not being healthy and that being the cause of the autoimmune disease, that these immunosuppressants are causing further vitamin deficiencies. So even if you have to be on the immunosuppressant, which hopefully we can reduce, but if you have to stay on it, Why don't we look at the gut health and look at these vitamin levels and really start to optimize your health and your immune system? Our immune system is at our fingertips. Every single one of us, the immune system is at our fingertips. We have the ability to change and adjust the strength of our immune system.
The thing I want the listeners to take away from that is right now, the billion-dollar industry is creating a narrative, and they're putting it out in all of these ads that you see on all of the mainstream media, all the television shows, everywhere you're seeing these ads for take this vaccine, take this medication to help this sickness, take this, take that. But nobody's ever talking about what can you do to actually minimize the effects of what happens when you do get that sickness. And that's all natural. And the reason why nobody's talking about it is because you can't monetize it. How can the pharmaceutical companies monetize you going and only shopping on the outside aisles of the grocery store? Don't even go in the inside aisles. The inside aisles is where all the boxes are and all the shit is. That's where I used to shop. That's the only places I used to shop. Jenni never goes on the inside aisles unless it's for diapers now. It's always shopping on the perimeter of the grocery store. That's where the healthy stuff is.
Right.
But you can't monetize that. So take that into your own thought process, whatever you want to say. Turn the commercials off. Do something for yourself.
Yes, and we are having, I am having a live webinar that is going to be recorded. So if you can't attend live, you can attend the recorded version.
The recorded version costs money, though. The live version is free. If you want the recorded version, it is $100.
The live version is going to be on April 11th, and I believe it's at 12:30 p.m., but we can confirm that. So April 11th, 12:30 p.m. Eastern Time, and the entire webinar is going to be discussing how your immune system is at your fingertips and the steps that we take exactly on helping individuals to identify what is causing more inflammation in their system, what is leading to vitamin deficiencies, what vitamins we even should be looking at, and how we can change, modify, and adjust to be supporting our immune system, being able to fight viruses, fight bacteria, fight autoimmune disease, and just make us the healthiest version and highest quality of life imaginable. So if you are interested in joining that webinar or know someone that you think may be interested in joining the webinar, please reach out to us, email us, go on the website. You'll be able to sign up there. You'll be able to sign up through a link on our social media. So go to social media. The link will be all over the place. So you will have the opportunity to sign up. My email is Jenni, Jenni, at bermanwellness.com. So you can email me, you can call our office, but reach out to us so that we can get you signed up for this live webinar on April 11th.
It's almost impossible for you to not take away at least one extremely valuable and potentially life-altering thing from this webinar.
Correct. At least one.
At probably least one.
Yes.
So that's going to be worth your time right there. And again, join live because it's free live. If you want the recorded version, it's $100.
Okay.
Jenni's giving me this look right now going, what are you doing?
Yeah.
I'm encouraging them to be there live.
Yeah. The live is really helpful because you can ask questions. You can listen to the questions other are asking, and then that'll lead you to a question that you want to ask. So the live version really is helpful to be able to interact and really take away more. If you absolutely cannot attend live, the recorded version is still very good because you're still getting quality information.
Perfect.
Cool.
Good.
Yes. So
that was a lot.
Go listen to that commercial and actually think about it and realize how many side effects are being listed and what this is actually doing to your system. And think about that with every drug that we're taking. But let's take a step back and say, okay, so what can I do differently? How can I support my immune system going into summer, going into travel mode, coming out of spring break? And what can I do to really make sure I'm living the highest quality of life imaginable?
Love it. Until next time.
Ciao for now.
Ciao for now.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.